Your eyes are the windows to your world. Yet millions of people across the country are slowly losing comfort, clarity, and even vision because of something they believe is just a little dryness. And today I am here to reveal why that simple irritation could be silently damaging your sight in ways you never imagined. So stay with me because before this video ends, I will share a real-life story of someone who ignored the signs for too long. A story that will shock you and hopefully inspire you to never make the same mistake. Have you ever felt that burning or gritty sensation after a long day on your phone, computer, or television screen? Have you rubbed your eyes thinking it was nothing but tiredness only to notice that the irritation keeps coming back? If so, you might be dealing with dry eye syndrome, a condition so common that it affects nearly 16 million Americans officially. But experts believe the true number is far higher because so many people never seek help. Here is my question for you, and I want you to share your answer in the comments. Have you ever experienced a time when your eyes felt so dry or irritated that it actually interfered with something important in your day? Maybe driving at night, maybe reading, maybe even enjoying time with loved ones. Sharing your story might help someone else realize they are not alone. Dry eye syndrome is often dismissed as a minor annoyance, but it has earned the name silent vision killer for a reason. The eyes depend on a delicate film of tears to stay moist, smooth, and clear. When this tear film becomes unstable, either because you are not producing enough tears or because the quality of your tears is poor, the surface of your eye begins to dry and break down. That breakdown can cause inflammation, pain, blurred vision, and over time, permanent changes that cannot be reversed. This is not something you can just blink away or splash with water. In fact, ignoring the problem allows it to progress quietly until one day you realize your comfort and clarity are slipping. The most shocking part is that the risk is higher now than ever before because of modern life. Constant screen exposure reduces our blink rate by almost half. Indoor air conditioning, heating systems, and polluted air all strip away moisture. Certain medications that millions of people take for blood pressure, depression, allergies, or even sleep can dry out the eyes without warning. Add to this the natural changes of aging, especially for women after menopause, and you can see why so many Americans are at risk without even realizing it. And while this might sound overwhelming, there is hope because simple awareness and small lifestyle adjustments can protect you. But remember the story I mentioned at the beginning, the one I will share with you at the end of this video. It perfectly illustrates how neglecting dry eye syndrome can lead to consequences that no one expects. So do not click away, because the lessons from that story may be the most important message you hear today. Now let us explore what really happens inside the eyes when dryness develops so you can understand the process more clearly. The tear film is not just water. It is made of 3 distinct layers. An oily outer layer that prevents evaporation, a watery middle layer that provides hydration, and a mucus inner layer that helps the tears spread evenly across the surface. If any of these layers are compromised, the system falls apart. For example, if the meibomian glands in your eyelids stop producing enough oil, your tears evaporate too quickly. If your body produces less of the watery component due to age or health conditions, your eyes cannot stay moist enough. If the mucus layer is weak, tears will not spread evenly, leaving dry patches that create irritation and blurred vision. What begins as a little discomfort can quickly escalate into chronic inflammation that damages the cornea, the clear window at the front of your eye. And once the cornea is scarred, vision loss can follow. Scientists have shown that untreated dry eye can even make you more vulnerable to eye infections because tears act as your first line of defense against bacteria and debris. This is why dry eye is not just uncomfortable, it is dangerous when ignored. And yet, most people push through the irritation believing it will pass, using redness relieving drops that mask the problem but never address the root cause. I want you to think of it this way. If your heart sent you pain signals, would you ignore them? If your joints ached every day, would you call it nothing? Then why do so many people dismiss persistent eye discomfort? Perhaps because the decline is so gradual that they do not realize how much they are losing until it is too late. But by being here, by watching this video, you are already one step ahead. You are choosing knowledge, and knowledge is the most powerful tool you have to protect your vision. And at the end, when I tell you that real-life story of a person who ignored these early signs, you will see exactly why this knowledge is priceless. Now that we understand what dry eye syndrome really is and why it should never be dismissed as a minor issue, let us talk about how to recognize the warning signs before they turn into something more dangerous. Because catching it early is often the difference between temporary discomfort and long-term damage that can affect your independence and quality of life. The most common symptoms include persistent dryness, burning, stinging, itching, or a scratchy sensation that feels like sand has been trapped under your eyelid. Some people notice blurred vision that improves with blinking, while others struggle with red, irritated eyes that make them look tired even when they have had plenty of rest. Light sensitivity is another signal, and in more advanced cases, people may notice difficulty driving at night or reading for long periods without constant breaks. You might even experience a heavy sensation in your eyelids, as if simply keeping your eyes open is a chore. These symptoms may appear gradually. So many people ignore them until they become constant, which is why awareness is so important. If you catch yourself experiencing 2 or more of these problems regularly, it is worth taking seriously and speaking with an eye specialist. The good news is that there are simple strategies you can begin using right away to ease discomfort and slow progression. The first and most effective step is the practice of intentional blinking. While it sounds almost too simple, reminding yourself to blink fully and more often during screen time keeps the tear film refreshed. A technique called complete blinking involves gently closing your eyes as if you were falling asleep, holding for 2 seconds, and then opening slowly. Doing this 10 times every hour during screen use can restore moisture. Another effective method is the 20-20-20 rule, where every 20 minutes you look at something 20 feet away for at least 20 seconds. This not only reduces strain, but also allows the tear film to reset. Creating a more eye-friendly environment is equally important. If you work in a dry office, consider using a humidifier to restore moisture to the air. Adjust your screen so it is slightly below eye level, which helps reduce evaporation. When outdoors, wear wraparound sunglasses that protect against both wind and ultraviolet light, because both can make dryness worse. Lifestyle adjustments also play a huge role in healing. Drinking enough water is critical because dehydration makes it harder for your body to produce tears. Aim for at least 8 glasses a day, more if you live in a hot climate. Nutrition is another cornerstone. Omega-3 fatty acids found in salmon, mackerel, sardines, flax seeds, chia seeds, and walnuts are proven to improve the oily layer of the tear film. Leafy greens rich in lutein and zeaxanthin, such as spinach, kale, and collard greens, help protect against oxidative stress that can worsen dryness. Vitamin A is also essential for healthy corneas, and deficiencies can directly lead to chronic dry eye, so including foods like carrots, sweet potatoes, and eggs can make a noticeable difference. Green tea is another powerful ally because it reduces inflammation, but be mindful of caffeine since too much can dehydrate you. While diet is powerful, habits like smoking and excessive alcohol are destructive. Smoking damages the meibomian glands that produce the oil layer of your tears, and alcohol contributes to dehydration, so cutting back or quitting altogether can bring immediate relief. Sleep plays an equally vital role. Aim for at least 7 hours of quality sleep each night, and if you suffer from sleep apnea, seek treatment because leaving it unchecked not only harms your overall health but also worsens dryness significantly. Some people also experience something called nocturnal lagophthalmos, where the eyelids do not fully close during sleep. If you wake up with severely irritated eyes, ask your doctor to check for this, as simple solutions like nighttime ointments or moisture goggles can be life-changing. Another overlooked practice is warm compress therapy. Applying a clean, warm cloth to your closed eyes for 10 minutes each evening helps unclog the oil glands and improves tear quality. Massaging the eyelids gently afterward can further stimulate gland function. Artificial tears are also a safe and effective way to relieve discomfort, but it is important to choose preservative-free formulas if you need them more than 4 times a day, because preservatives can irritate the eye with frequent use. For severe cases, ophthalmologists can prescribe medications that reduce inflammation or stimulate tear production, and in some cases, tiny plugs can be placed in the tear ducts to help tears stay on the surface longer. But what if you want to know whether you are at risk before symptoms even appear? The answer lies in awareness of risk factors. Women over 50, people who wear contact lenses daily, individuals with autoimmune conditions, and anyone taking multiple medications are all more vulnerable. If you fall into one of these groups, routine eye exams are your strongest protection because modern diagnostic tools can measure tear film quality and detect early changes before vision is compromised. You might be wondering whether natural remedies can really help, and the truth is that many gentle approaches can make a difference if practiced consistently. Aloe vera gel applied around but not inside the eyes has anti-inflammatory benefits. Cucumber slices placed on closed eyelids for 10 minutes provide cooling relief and hydration. Even simple eyelid hygiene with diluted baby shampoo or commercially available lid scrubs prevents buildup that blocks oil glands. Consistency is the secret because dry eye is often a chronic condition that requires daily attention rather than a quick fix. And this brings me to a surprising fact that many people never consider. Stress plays a big role in eye health. When you are under constant stress, your body produces more cortisol, which increases inflammation throughout your system, including in your eyes. Stress also leads to poor sleep, unhealthy food choices, and long hours on screens, all of which worsen dryness. So managing stress through meditation, gentle exercise, deep breathing, or even hobbies you love is not just good for your mental health. It is a direct investment in your vision. Imagine how much better you would feel if you combine these strategies: drinking more water, eating nutrient-rich foods, sleeping deeply, practicing blinking techniques, and managing stress. The transformation in your eye comfort could be noticeable in just a few weeks. Now, at this point in the video, let me invite you to take one important step. If you are finding value in what you are learning, share this video with a friend or family member who spends long hours on screens or constantly complains about tired eyes, because sharing knowledge could be the spark that saves someone's vision. As we move further into this important conversation about dry eye syndrome, I want you to imagine how profoundly your daily life depends on clear, comfortable vision. Because every moment from reading your favorite book, to watching your grandchildren play, to driving safely on the highway, relies on healthy eyes that remain hydrated and resilient. When dryness takes hold and becomes chronic, the ripple effects can impact your work, your hobbies, your mood, and even your relationships. Many people silently endure the discomfort, brushing it aside as a small annoyance, until the day comes when the problem becomes so severe that even ordinary tasks feel like battles. Let me share something that surprises most patients when they first hear it. Untreated dry eye does not only cause irritation, it can actually damage the surface of the cornea over time. Small scratches known as abrasions may form, leading to infections or scars that permanently affect clarity. That is why addressing this condition early is not optional, it is essential. The story of one of my patients highlights this truth. A retired teacher ignored her symptoms for years because she assumed it was just part of aging. She used over-the-counter drops occasionally but never made lifestyle changes or sought medical advice. By the time she finally visited an eye specialist, her corneal surface had developed scarring that limited her ability to read small print, something she deeply loved. This outcome could have been prevented with consistent care. I share this story not to frighten you, but to remind you that your eyes deserve daily attention just like your heart, your bones, and your overall health. Think of your vision as a precious jewel, and every choice you make is either polishing it to shine brighter or allowing it to dull. Now let us look at the future of treatment, because modern science is making remarkable progress. Researchers are exploring biologic eye drops made from a patient's own plasma that contain growth factors to heal the ocular surface. Others are testing light-based therapies that stimulate oil gland function with impressive results. Advances in gene therapy may one day correct underlying causes in people with autoimmune-related dryness. This is an exciting time because what once felt like a frustrating, lifelong condition is now being met with innovation and hope. But until these breakthroughs become widely available, the power remains in your hands to protect and improve your vision today through small, consistent actions. Another overlooked area is the connection between systemic health and dry eye. Conditions like diabetes, thyroid disorders, and rheumatoid arthritis all influence tear production and eye surface health. That means taking care of your whole body, not just your eyes, is part of the solution. Regular checkups, balanced nutrition, movement, and staying on top of chronic conditions are not only life-extending, but vision-preserving. People often ask me whether screen technology itself is part of the problem. And the answer is yes. Studies confirm that when we use phones, tablets, or computers, our blink rate drops by nearly half. Less blinking means tears evaporate faster, leaving the eye surface exposed. Blue light may not directly cause dryness, but it disrupts sleep cycles, which indirectly makes symptoms worse. That is why using screen filters, enabling night mode, and limiting device use before bedtime can support eye health more than most realize. Another misconception is that only older adults suffer from dry eye. The truth is that young adults and even children are increasingly at risk because of constant screen exposure and indoor lifestyles. Parents should watch for signs like excessive blinking, rubbing eyes, or avoiding reading, because sometimes dryness is misinterpreted as attention issues when it is really a comfort problem. Encouraging children to spend time outdoors, to blink intentionally during digital use, and to stay hydrated builds habits that will serve them throughout life. I want you to ask yourself right now, what daily habit could you adjust to protect your eyes? Could it be adding more omega-3 rich foods to your meals? Could it be taking more screen breaks? Could it be creating a bedtime routine that ensures you sleep well? Leave your answer in the comments below, because sharing your intention might inspire someone else to take the same step. Your voice can be a ripple that spreads encouragement and healing through our community. Before we come to a close, let us revisit the most powerful truths from this journey together. Dry eye is not a minor inconvenience, but a condition that can quietly steal comfort and even damage vision if ignored. Recognizing symptoms early and seeking help is crucial. Blinking fully, practicing the 20-20-20 rule, eating nutrient-dense foods, staying hydrated, and managing stress are daily habits that empower you to control your symptoms. Treatments from artificial tears to advanced medical therapies exist, and no one needs to suffer in silence. Protecting your eyes is about valuing yourself enough to give them the care they deserve. Your vision is your window to life's most meaningful moments, and safeguarding it should never wait until tomorrow. As we close, I want to invite you once again to join our community of health-conscious viewers. If you found this information valuable, please like this video, share it with your loved ones, subscribe to our channel, and leave a comment with your thoughts or questions. Every engagement helps us reach more people who may be struggling in silence with the very same problem. Together we can spread awareness and prevent unnecessary suffering. And finally, here is a vital reminder. This video is intended for educational purposes only and should not replace professional medical advice. Always consult your doctor or qualified health provider regarding any questions or concerns about your eye health or before making changes to your treatment plan. Thank you for spending this time with me. Thank you for valuing your health, and may your eyes remain bright, strong, and full of life.